Hello everybody, thank you for joining this session about healthcare, where we wanted to share with you innovations about solutions we have designed to provide you with a better care. My name is Frédéric Helding and I'm a business developer at Proximus, focusing on hospitals, part of the account team, also taking part of this vertical. We'll start with few challenges we face on the market, and as you know, first, or the biggest trend today is the growing of the population. There is more and more people on the planet, and a lot of people are getting older. There is more and more seniors together with us. Besides this evolution, there is also new trends to develop new care, which is much more preventive instead of working as we do today, which is a kind of reactive care. So we need to evolve to a better care, which is much more real-time focused. So of course, to cope with this gap, we face different lack of professional staff. There is a gap in terms of GPs or specialists available for patients on the market, even in Belgium today. We lack investments in new infrastructures that will help us to provide a better care to the most of us. Technology will play an important role into this evolution. On the first side, we will gather more and more data and information about a patient, its medical status, through a lot of tools already existing today. So as you know, there is already smartwatches, connected objects, there is features like artificial intelligence, machine learning. This is all tools that we can use to better care about the patients. On the other side, the more data we will collect, the more we need to care about how we access this data, how we integrate this data, how we will use it. The access must be secured, and we will need, of course, more and more connectivity solutions to connect it and to share this information with different care practitioners. There is a few constraints for adopting those new solutions. Of course, there is a lack of budgets and knowledge to help growing faster. You need also to gain much more trust, much more confidence into those solutions, which needs to also align together and interoperate on the market to be able to better help the patients while moving around or to foreign countries and stuff like that. 5G, of course, is a major trend that will help us addressing those challenges and filling the gap that we just explained, and will help us provide better care to a bigger amount of patients. Now, to deploy and to use 5G in the best way, we need, of course, a close collaboration with you, with our customers, to better understand what are the use cases and how 5G can progressively be adopted in the hospitals and in the elderly homes infrastructures. 5G will play a critical role, in fact, in digital health. Why? Because this new technology will provide us with 10 times less latency. That's very important, we'll see it later on, and 10 times more bandwidth, which will allow us to provide better quality images, better video, and define new solutions, again, getting closer of real-time care with people on the move, providing interactivity between operating rooms, for example, robotics and stuff like that. Nonetheless, this technology is also much more reliable, in fact, than the current networks. So it will allow to assist and to provide a better care to a large amount of patients, where they are. A few use cases about 5G and healthcare is first that it will help healthcare to become much more affordable, in fact. It will help healthcare to transform itself by adopting new services, like we already tested with a few customers, about drones, for example, so that we'll be able to transport and exchange medical products between between hospitals in the first place, but also maybe later with patients. And of course, there is larger benefits we can imagine about 5G. 5G will be required, of course, for autonomous cars and other consumer-centric services, but it will also provide high-quality tele-expertise, telemedicine, robotics on distance, assistance between hospitals, artificial intelligence things, continuous monitoring of patients with wearables and stuff like that. Besides 5G, Proximus can provide you with a lot more, in fact. This is really the trend that we see in the coming years. But today we can already help you develop custom applications, for example, for the patients that will include a lot of features as making an appointment, reminders for taking the pills, getting or remaining in touch with my family, monitoring my own health, monitoring my environment, what's happening into my home, and will drive you or help you going to the hospital where we can improve the different business processing while going through the hospitals, at the entrance, at the admissions, while waiting in the operating rooms and stuff like that. And we can also develop and provide you applications to help the professional staff, in fact, to better follow and to know what's the status with each patient, where they are into the care pathway across the hospital. To do that, of course, those applications rely on high resiliency networks and combine different technology to make sure the technology and the service is always available to the different users. So let's now focus much more on a few samples and examples we realized more recently in two different domains. So I'll present you here different use cases around tele-expertise, telemedicine, entrance monitoring, how we can track different assets, monitor temperature, and how we set up also a pilot focusing on chronic disease and heart monitoring. The first example is a mobile trolley we developed here recently during the lockdown and COVID period to help our customers to remain in contact with patients, initially in elderly homes. But we've seen that this trolley has also get traction from hospitals for other purposes. So this one can be used for interpretation purposes, for example, can be used to improve communication within the hospital or outside of the hospital, can be used to provide remote expertise or assistance for a patient. It can even be used within operating rooms. So this one is based on standards, is fully compliant with clinical cleaning requirements, and is available on the shelf today. Another example of developments we made also in the context of COVID is entrance monitoring. So this entrance monitoring solution focuses on capturing the temperature, the body temperature of a patient when entering the hospital. As you know, there is some symptoms of the COVID linked to the temperature, and here we can detect this disease and take actions like alarming or informing or driving the patients into specific areas for much more assistance. This is based on video surveillance thermal cameras and can be combined with display solutions with telling or counting how many people are getting in and out of the hospitals, and is of course provided with tools around reporting statistics and management for the entire solution. This is again something which we can provide today. Another solution which has been developed a while ago for a customer, which is ISPPC, also known as CHU de Charleroi, is an asset tracking solution in order initially to follow blood bags which are exchanged between hospitals and analyzed into a labo. So the question of the customer is, how can I ensure that the blood which is transported by a third party from the hospital to the labo is always transported in the appropriate conditions, never too cold, never too warm. To answer this challenge, we developed a solution which is based on our IoT sensors, which are connecting to the LoRa network. And we've configured those with a time interval to monitor the temperature every 10 minutes, but also with an alarm that will inform the driver or any other person involved into the process if something goes wrong. Doing that, we know that the blood, when reaching the hospital, is not provided in optimal conditions, and we can decide to use it or not. Since monitoring this kind of things, the customer has been able to improve the transport of the blood bags between the hospitals and so on, being informed of how much time it takes at every steps, and to improve also the frigo boxes they use to transport this kind of products. Another solution, always linked to the monitoring of temperature, has been to provide another customer, which is Clinique Saint-Yann, with a solution to capture temperature and humidity, also in fridges, but also in technical rooms. The customer required us to provide a solution based on standards, which can be later on integrated with other tools and processes between the hospital. And we provided here again a solution based on the LoRa network. So we use the same kind of IoT sensors. We deploy them into the different technical rooms and fridges, and we monitor there the temperature and humidity. The customer uses here our MyThings platform to get all the graphics, all the provisioning tools and monitoring tools to manage the solution himself. He can add and remove sensors as he wants, and we will eventually later on integrate this with the alarm servers and telephony system if needed. So here again, those are examples of evolutions towards real-time care. Last but not least, a great pilot we got this opportunity to build also with ISPPC and CHU de Charleroi, which is a pilot focusing on chronic disease, more especially heart failure disease. Why? Because this disease is as severe as cancer. So there is 250,000 people in Belgium impacted by this issue. Most people are seniors from 60 years old, but it can happen that younger people also are faced with this issue. The biggest issue is in fact that this disease only decreases or is impacted in time. There is no recovery possible. So we need to monitor as close as possible the evolution of the disease with the patient. In current circumstances, a patient has to really regularly go to the hospital, let's say for example every week, to take basic parameters. Those parameters are the weight, the blood pulse, the blood pressure, and saturation. So it's a lot of effort for the patient going to the hospital, and it's not always optimal because the patient can also be stressed, can maybe go too fast or too late to the hospital. So together with the customer, we've built a solution which provides sensors to the patient, and those sensors, being Bluetooth sensors, will measure the different parameters together with the patient, and it will be taken once a day. So every day, each patient will use the solution, will use the different sensors, and an application which is installed on the smartphone. On these applications, there is a lot more features like telemedicine, tele-expertise, surveys, questionnaires, reminders, and everything. And the data is sent through our platform, API solutions, to be forwarded to the customer. There the data is integrated into the backend systems of the cardio team of ISPPC. So the pilot is just over. It has been a great experience and really appreciated by the customers, especially in those COVID times, because people were in lockdown, alone at home, and here there was still some communication, some monitoring, some trust with the hospital, and if something happens, people are of course prevented with the alarming system. If something has to be organized or planned to improve the care or the products which are provided. So an orange alarm or a red alarm will be generated on the on the cardio team side to decide what has to be done. So those are real-time examples that will help us to pave the way to new developments about connected care, which is mainly monitoring the patients while on the way at home and stuff like that, but also to improve the services we wanted to provide at home, like connected home, because the environment can also have an impact on the evolution of any disease or a medical situation. And we wanted to extend those services to mobile health by providing this kind of applications on the big screen, on the small screen, and helping to monitor the patients real time, but also provide them the best patient experience, in fact. So let's go together with a better care, with you, with our customers, and with our ecosystem of accelerators, now part of the Proximus group, that will help us with mobility, with deploying applications, with advanced security, and helping you to transform yourself and adopt this new digital way of working.
Proximus. Think possible.